For our last application cycle, we had 100% acceptance rate to med school, which is unheard of. I think it's important to establish that this is a pattern of success through time. In the past 5 years, 80% of our students were accepted to med school. So we're always double the national average. That, I think, just speaks to the ability of students to find success here, to find the mentors they need, to find the academic strength and skills they need, to be ready not only to apply successfully, but to thrive once they get to medical school.
If your goal is to become a doctor, then we will help you navigate the requirements and the path, all the different ways that you can get to that point. How you layer in what you want to do and what that timeline is.
You're going to take some gap years, right? I'm actually going to talk to you about that. Oh, so you're going to apply right away.
Because we do that, it means that when the students are applying to school, they have all these wonderful experiences, they have a better sense of their identity and what they want out of their programs, what kind of medical schools they want to go to, what kind of physicians they want to be.
Pre-meds typically have the stereotype of they're super competitive. We've had a strong incentive to collaborate with one another.
Let's start with the one on the bottom and try to find your value of Vmax and Km.
Alpha is 2.5.
One student brings their own strengths, another student brings other strengths, and you will benefit from their knowledge and they'll benefit from yours, and you'll be more successful.
The culture is supportive and collaborative and encouraging. The students are extremely ambitious and self-motivated. They are driving themselves to excel. But because everyone is trying to operate at the highest level, and because we as the faculty are trying to push students to the best possible versions of themselves, there is a lot of challenge, but challenge with support.
KC Meds as an organization is really focused on community building, information sharing, and access, because they are driven to say, if you don't have connections to these, we're going to build them for you. We're going to host an MCAT session because we want every student to feel ready for the MCAT. We're going to build volunteer opportunities because we want every student to have healthcare experience and exposure. That mentality from our student base means that our students don't feel alone. They don't feel isolated. That makes it easy for people to opt in, be involved, and find like-minded peers.
We've got a lot for you today. As usual, we're going to start with a celebration of learning, so go ahead and grab your quiz paper and let's go ahead and take this brief quiz.
We hear from our students who are in med school, curricularly, we're preparing the students really well.
Rate constant K1.
The classes that are the most memorable for me, you weren't handed the answers on a silver platter. You had to really work for them.
So this is going to look like a dark gray or like almost like bilateral or unilateral.
We can challenge students and we can push students, and that doesn't mean that we are trying to push one ahead of another. We want everyone to succeed in the face of a rigorous experience. The capillary inform the sheath. That is the true mark of success as an educator. You are raising the performance of everyone, not just the already high-performing individuals. And we can contrast those with what are called fenestrated.
With biomedical services and health humanities, we're learning about different cases that we're going to interact with in the ER. Every week we studied 2 different cases. We talked about asthma, we talked about hypertension, a ton of different ER cases that you'd see on the day-to-day. Another component of the class is the volunteer aspect, so we go into the ER and volunteer, and then we actually get to see these patients and see these cases firsthand.
Students will complete 4-hour volunteer shifts at the hospital where they would do some of the things other volunteers might do, like providing some patient support, but the students also get pulled into rooms to observe procedures and have the opportunity to follow a patient from intake all the way up through admission into the intensive care unit.
So for the actual treatment of strokes, ischemic strokes, because it's blood clots, they're treated.
After each ER volunteer session, we write about the case, a 400-word write-up. And when I'm applying to med school now, and I have a log of all the different experiences that I've had, And I really like being able to study these cases and then relate it back to what I've been reading in the textbook. It brings it to life.